Warning: some patients implanted with the Essure System for permanent birth control have experienced and/or reported adverse events, including perforation of the uterus and/or fallopian tubes, identification of inserts in the abdominal or pelvic cavity, persistent pain, and suspected allergic or hypersensitivity reactions. If the device needs to be removed to address such an adverse event, a surgical procedure will be required. This information should be shared with patients considering sterilization with the Essure System of permanent birth control during discussion of the benefits and risks of the device. Hi, I'm Dr. Amy Brenner, and I'm a physician specializing in obstetrics and gynecology. I've been in private practice for 16 years. I love coming to work every day, basically because every day is different. The purpose of this video is to provide information to help women considering permanent birth control understand their options, including Essure, and be sure they are aware of the risks and benefits of the methods available, so that they're able to make the right birth control choice for themselves. This video does not take the place of talking with your doctor about birth control. When considering Essure, make sure you review the patient information booklet and patient-doctor discussion checklist. Ask your doctor any questions you might have.
In the past, what I've used for birth control were birth control pills, which just wasn't working out for me. I am not really good at remembering to do anything on a daily basis. So that's when I decided to do the IUD. So that worked out for me, but it just wasn't permanent, and I was ready for something permanent.
Permanent birth control is highly effective contraception that provides permanent prevention against pregnancy. It is irreversible, so it's meant for those who have decided that they do not want to have any more children. There are various permanent birth control options for men and women. Tubal ligation for women and vasectomy for men are surgical methods. Essure is a minimally invasive procedure that does not require incision for placement. All work by keeping the man's sperm from reaching the woman's egg and fertilizing it. For a woman, permanent birth control involves blocking the fallopian tubes that carry sperm to the egg. The sperm cannot reach the egg to fertilize it. Blocking the tubes prevents pregnancy. For a man, a vasectomy is permanent birth control that involves cutting or blocking a segment of the vas deferens, the tubes that carry the sperm. The decision to have permanent birth control is a personal and emotional one that shouldn't be taken lightly. Because it is not reversible, you need to be certain that you do not want to have any more children, and be aware that there are highly effective methods of birth control that are not permanent, which may allow you to become pregnant when stopped. When women come to me to ask about permanent birth control, they want to have this discussion because they no longer want to take a daily, weekly, or monthly birth control. They knew their families were complete and they wanted to stop worrying about getting pregnant. Or they want a method that does not contain hormones. Each year, less than 1 in 100 women who use permanent birth control will get pregnant. It's important to understand the risks of permanent birth control before you have any procedure. The risks depend on what method you choose. There are risks with any medical procedure, including sterilization. For all methods, there is a chance that you could still become pregnant. No methods of permanent birth control protect against HIV or other sexually transmitted diseases.
My husband and I started talking about permanent birth control not long after our twins were born, and we knew that we were ready to do something permanent. As far as options for permanent birth control, we had talked about it some, but really hadn't looked into any other options other than having, surgery, having your tubes tied. I didn't know there was really any other option out there until I saw it at my doctor's office.
Essure is a permanent birth control procedure that works with your body to create a natural barrier against pregnancy. The Essure procedure is usually performed in your doctor's office. During the procedure, the doctor will place a tiny insert into each of your fallopian tubes. Over a period of about 3 months, tissue forms around the inserts. The buildup of tissue creates a barrier that keeps sperm from reaching the eggs and prevents conception.
So at one of my regular checkups with my gynecologist, I mentioned to her that I wanted to pursue or look at other options for birth control. She mentioned Essure, and I talked with her a little bit about it. She gave me some pamphlets. I went home, talked with my husband, and decided that Essure was the right choice for me.
Essure may be right for women who are certain that they do not want any more children, want a permanent form of birth control, and would like to stop worrying about getting pregnant. Essure may also be right for women who prefer a method or procedure that does not take a lot of time, can be done in a doctor's office, does not require cutting, leaves no visible scars, and does not contain any hormones. Essure is not right for you if you are uncertain about ending your fertility, you suspect you are pregnant or have only one fallopian tube, or you have one or both fallopian tubes closed or obstructed. Essure is also not right for you if you have had your tubes tied or tubal ligation, you are allergic to contrast dye used during X-ray exams, you are unwilling to undergo the Essure Confirmation Test, you have unexplained vaginal bleeding, or you have suspected or known cancer of the female reproductive organs. Essure only works when an insert has been successfully placed in each fallopian tube. If this is not possible in your case, you might need to try a repeat placement procedure or consider a different form of birth control.
A couple things that appealed to me about the Essure procedure was to not be taking the hormones any longer. And the second part was that I could have it done in the office.
What I liked about the Essure procedure was that there were no incisions made and that it was, I could do it in the doctor's office. I didn't have to go to the hospital.
Your doctor will permanently place a soft and flexible insert into each of your fallopian tubes. No incisions are needed during the procedure because the inserts are placed through the natural pathway of your vagina and cervix. Over the next 3 months, your body forms a natural barrier around the Essure inserts that prevents sperm from reaching your eggs. During the 3-month period, you must continue using another form of birth control to prevent pregnancy. 3 months after your Essure procedure, you will need to have an Essure Confirmation Test to determine whether you can rely on Essure for birth control. Your doctor will advise you on the type of test that is right for you.
I was awake during the procedure and I was able to see the inserts being placed, and really it only took about 45 minutes total for the procedure. I did feel a little bit of cramping. Not too much though, it wasn't unbearable. Then afterwards, the cramping will last for a couple more days.
The total procedure time on average is 36 minutes. You can remain fully awake during the procedure. Your doctor may recommend a medicine to reduce anxiety. Sometimes I use a local numbing anesthetic to reduce patient discomfort. Most women are able to leave the office about 45 minutes after the procedure is completed. Most women return to normal activities after 1 or 2 days. Cramping, mild to moderate pain, nausea or vomiting, dizziness or lightheadedness, and vaginal bleeding have been reported by women during or in the hours or days following the procedure. Ask your doctor about what to expect, and if you continue to have these symptoms or experience worsening of any of these symptoms, you should contact your doctor.
I went to Dr. Brenner's office for the procedure. I had a little bit of cramping and took the afternoon off, but by the next morning I was back to myself and able to go to work.
Essure is not effective right away. It usually takes 3 months for your body to form a natural barrier around the Essure inserts. 3 months after your Essure procedure, you must see your doctor for the Essure Confirmation Test before you can rely on Essure for birth control. You must continue to use another form of birth control to prevent pregnancy until your doctor tells you that you can rely on Essure for birth control.
Dr. Brenner gave me all my options of what I would need to do for birth control over the next 3 months until I could have the confirmation test done. I chose to do birth control pills just because it seemed like the easiest thing for my lifestyle at that time. So when we were Looking at the x-rays while I was having the confirmation test, Dr. Brenner looked up and gave me the news that everything worked and the Essure was going to be my permanent form of birth control and I could stop the birth control pills that I was taking.
The Essure Confirmation Test verifies that the inserts are in the correct location and sometimes tests whether the tubes are blocked. There are two types of confirmation tests: a modified HSG or a transvaginal ultrasound, TVU. During the modified HSG, a special contrast dye is injected into your uterus. The dye is visible on X-rays. This lets the doctor confirm that the inserts are properly placed and that your tubes are blocked. During the TVU, an ultrasound device will be placed into your vagina. The ultrasound will enable your doctor to see the Essure inserts within your fallopian tubes and determine if the inserts are in the proper place. If the doctor is unable to determine if the inserts are in the proper place with the TVU, you will need to have a modified HSG. Your doctor will determine which Essure confirmation test is appropriate for you. In some cases, it may be necessary to have both tests. Your doctor may tell you that you may not be able to rely on Essure. If this happens, you will need to use an alternative form of contraception. For some women, it may take longer than 3 months for Essure to completely block the fallopian tubes, requiring a repeat confirmation test at 6 months. You must continue to use another form of birth control to prevent pregnancy until your doctor tells you that you can rely on Essure for birth control. Based on clinical studies, approximately 8% of women who undergo attempts at Essure placement are not able to rely on the device and will need to use an alternative form of contraception.
When Dr. Brenner was explaining the details of the procedure to me, she really explained the risks and the benefits as well as the pros and cons. Nothing's 100%, so she well informed me that there was still a rare chance that I could still get pregnant afterwards.
No method of birth control is 100% effective. And even if your doctor tells you that you can rely on Essure, there is still a small chance that you could become pregnant. The risks of Essure on a developing fetus have not been established. If you do become pregnant with Essure, you may be at risk for an ectopic pregnancy, which is when a pregnancy occurs outside the uterus. This can result in serious and even life-threatening complications, so you should contact your doctor right away if you think you may be pregnant. One of the questions that I am asked a lot is what the inserts are made out of. The inserts are made from polyester fibers, nickel titanium, platinum, silver tin, and stainless steel, which is made of iron, chromium, and nickel. These same materials have been used for many years in cardiac stents and other medical devices placed in other parts of the body. However, some women may develop allergic reactions to the inserts after they get Essure and have signs or symptoms such as rash and itching. This may occur even if there is no prior history of sensitivity to those materials. There is no reliable test to predict ahead of time who may develop a reaction to the insert. Some women may experience continued pain or develop new pain after Essure placement.
The only concern I had was having some kind of reaction towards the nickel that the inserts are made of. My doctor definitely talked to me about that, and I felt more comfortable after she explained that to me.
Because the Essure insert contains metal, you should tell all your doctors that you have had the Essure procedure before getting an MRI. Contact your doctor if abdominal, pelvic, or back pain continues or worsens after placement, or if you develop new pain or think you may be experiencing an allergic reaction, because this may be a sign of an Essure-related problem. If this is the case, you may need treatment, including the possibility of having surgery to remove the inserts. Other symptoms have been reported to FDA by women who have had the Essure procedure, although they were not seen in the clinical trials supporting Essure approval. The more common symptoms reported include headache, fatigue, weight changes, hair loss, and mood changes such as depression. It is unknown if these symptoms are related to Essure or other causes. There is a small possibility that the Essure insert could poke through the wall of the uterus or fallopian tubes, and that it may be found in other places in the abdomen or pelvis. The rate of perforation in the original pre-market studies was 1.8%. The rate of an insert being found in the abdomen or pelvis hasn't been determined, but it is uncommon. If either of these things happen, the insert may become ineffective in preventing pregnancy and may lead to serious side effects, such as bleeding or bowel damage, which might need surgery. It is important to understand that the Essure procedure should be considered permanent. If you and your doctor decide that Essure should be removed after placement, an additional surgical procedure may be required. In complicated cases, your doctor may recommend a hysterectomy or removal of the entire uterus. Removal of the device may not be covered by your insurance company.
I would definitely recommend Essure to any woman that is, 100% sure that they're done having kids and if they've been on birth control for a long period of time.
With 3 kids, I'm always on the go. I got the Essure about 6 years ago, and I would definitely do it again if I was given the choice to. 3 kids is the exact amount that I wanted for my family to be complete.
It's been 3 years since my procedure, and I know that my family was complete then, and it's complete now, and I'm happy with the decision that I made.
Talk with your doctor about any questions you might have as a result of watching this video. Visit the website and read the patient information booklet and review the patient-doctor discussion checklist in the patient information booklet or on the website at www.essure.com. Essure is indicated for women who desire permanent birth control or female sterilization by bilateral occlusion of the fallopian tubes. Warning: some patients implanted with the Essure system for permanent birth control have experienced and/or reported adverse events, including perforation of the uterus and/or fallopian tubes, identification of inserts in the abdominal or pelvic cavity, persistent pain, and suspected allergic or hypersensitivity reactions. If the device needs to be removed to address such an adverse event, a surgical procedure will be required. This information should be shared with patients considering sterilization with the Essure system of permanent birth control during discussion of the benefits and risks of the device. Essure is not right for you if you are uncertain about ending your fertility, suspect you are pregnant, can have only 1 insert placed, have had your tubes tied, have a known allergy to contrast dye, are unwilling to undergo the Essure Confirmation Test, have unexplained vaginal bleeding, or have suspected or known cancer of the female reproductive organs. You should delay having the Essure procedure if you are or have been pregnant within the past 6 weeks, have an active gynecological infection, or are in the second half of your menstrual cycle. Tell your doctor if you are taking immunosuppressants, have or think that you may have a history of metal allergies, or an allergy to polyester fibers, nickel titanium, platinum, silver tin, or stainless steel, or any other components of the Essure system. Are currently using an IUD for contraception, or have had or are considering a procedure to reduce bleeding from the uterus, such as endometrial ablation. Warning: be sure you are done having children before you undergo the Essure procedure. Essure is a permanent method of birth control. Warning: you must continue to use another form of birth control until you have your Essure Confirmation Test 3 months after the procedure, and your doctor tells you that you can rely on Essure for birth control. For some women, it may take longer than 3 months for Essure to be effective, requiring a repeat confirmation test at 6 months. Talk to your doctor about which method of birth control you should use during this period. If you rely on Essure for birth control before receiving confirmation from your doctor, you are at risk of getting pregnant. During the procedure, in the pre-marketing study, some women experience mild to moderate pain, 9.3%. Your doctor may be unable to place one or both Essure inserts correctly. In rare cases, part of an Essure insert may break off during placement. If breakage occurs, your doctor will remove the piece if appropriate. There is a risk of perforation of the uterus or fallopian tube by the hysteroscope, Essure system, or other instruments used during the procedure. In the original pre-market studies, perforation due to the Essure insert occurred in 1.8% of women. A perforation may lead to bleeding or injury to bowel or bladder, which may require surgery. Your doctor may recommend a local anesthesia. Ask your doctor about the risks associated with this type of anesthesia. Immediately following the procedure. In the pre-marketing study, some women experienced mild to moderate pain, 12.9%, and/or cramping, 29.6%, vaginal bleeding, 6.8%, and pelvic or back discomfort for a few days. Some women experience headaches, nausea and/or vomiting, 10.8%, or dizziness and/or fainting. You should arrange to have someone take you home after the procedure. In rare instances, an Essure insert may be expelled from the body. During the Essure Confirmation Test. As one of the Essure Confirmation Tests, a modified HSG, requires an X-ray, you may be exposed to very low levels of radiation, as with most X-rays, if this test is used. Some women may experience nausea and/or vomiting, dizziness and/or fainting, cramping, pain, or discomfort. In rare instances, women may experience spotting and/or infection. Long-term risks. Pain, acute or persistent, of varying intensity and length of time, may occur and continue following Essure placement. This is also more likely to occur in women with a history of pain. There are reports of an Essure insert being located in the lower abdomen and pelvis. If this occurs, you cannot rely on Essure for birth control. Patients with known hypersensitivity to any of the components of the Essure system may experience an allergic reaction to the insert. In addition, some patients may develop an allergy to nickel or other components of the insert following placement. Symptoms reported in women using Essure that may be associated with an allergic reaction include hives, rash, swelling, and itching. There is no reliable test to predict who may develop a reaction to the inserts. No birth control method is 100% effective. Ectopic pregnancies, pregnancy outside the uterus, may occur with Essure. This can be life-threatening. If insert removal is indicated, surgery will be necessary. The safety and effectiveness of Essure has not been established in women under 21 or over 45 years old. Essure does not protect against HIV or other sexually transmitted diseases. Essure is available by prescription only. Talk to your doctor about Essure and whether it is right for you. Review the patient-doctor discussion checklist in the patient information booklet with your doctor before deciding to have the Essure procedure.